Friends, welcome to Easy Nurse, where nursing education made easy. So in this session, let's discuss regarding the first and the second sem of nursing foundation, where you can see the most repeated and definitely appearing questions for your upcoming exams. So let's get started. Coming to the first question is regarding the nursing process. What is this nursing process? It's a systematic as well as systemic patient-centered approach which is used for the nurse to ensure the quality care. You need to just not give a care, but the quality, the amount of care that you're giving should have good quality. And involving the assessment process, it has different processes in it, where assessment, diagnosis, planning, implementation and evaluation are different steps of this kind of nursing process. So here you can see it is a repeated process which is aiming to identify and address the patient's needs and outcomes effectively. It's not just you're giving the care for the patient, but also taking into what the patient is needing, that kind of care you're giving to the patient. As we just mentioned, there are steps. The assessment, which is one of the most important steps, collecting the comprehensive data about the patient health status through observations, through interviews, and the physical examination is performed under the assessment process. So coming to the second step is the diagnosis. So here you're analyzing the assessment data. Whatever data you have collected through the assessment process, you're analyzing it and you're identifying the patient's health problems. Through that data, what you have collected, you are identifying what is the disease, or if the patient is having any kind of disorder, you're identifying it through the diagnosis. So this is also one of the second important step. Coming to the third step is the planning. Here you're developing a care plan. So here what do we mean? We are planning according to what is the disorder the patient is having. According to the history collected, you're planning the care. In the sense, you're making certain plan how we can give the care for the patient. That is the third step. So here specific goals are made, outcomes, and determining the interventions which is required to address the nursing diagnosis. According to the diagnosis, you're planning the care. And the fourth step is implementation. Implementation in the sense you're executing it. So whatever plans we have made, you're bringing it into the action. So executing the planned interventions to achieve the desired outcomes. So we have certain outcomes that the patient should go healthy. She or he should be healthy. That is our outcome that we are planning. So you're ensuring you're providing appropriate and safe care to the patient. You're bringing the plan, what you have done, into the action. And the final step of nursing process is the evaluation process. What is evaluation? You're assessing. So whatever care that you have given, is it effective or no? You're evaluating it. You're checking it. So assessing the patient's response and interventions, where you're determining if the goals and the outcomes have been met and adjusting the care plans as needed. So these are the different 5 important steps of nursing process, which is one of the most important questions for your upcoming exam. Coming to the second question is the routes of administration of the medications. There are different routes in which we can administer any kind of medication for that matter. Coming to the first route is the oral route. It is also called as PO in medical terms. So it is through the swallowing, the medications are absorbed through the digestive system. You're swallowing it through your mouth. So common, convenient and non-invasive process. You're not invading the skin, and it is one of the most common and a convenient form of giving the medications to the patient. Coming to the second route is the intravenous route. Here it is injected directly into the vein. So you can see your veins in your hands, where in which you can inject these medications, the intravenous medications, directly to the veins. So basically it is having rapid effect. So for immediate effect, we are giving the medications to the intravenous route. Rapid effect used for emergencies and continuous infusions. So if there is any dehydration for the patient, continuous infusions is necessary. So intravenous route is one of the most effective and immediate effect is seen. Next route is intramuscular route. It's also called as IM route. It is injecting into the muscles. So we are injecting the medications into the muscles. Moderate absorption is seen, not very rapid, not very slow. Moderate kind of absorption is seen, and it is used for vaccines and certain medications. Usually the vaccines and few particular medications are given through intramuscular route. Coming to the next is the subcutaneous route. Here you're injecting the medications under the skin. So just under the skin we are injecting the medications. Slow absorption is seen, usually the insulin and also other medications, particular medications. You can see subcutaneous route, it is usually the insulin which is being injected. Coming to the next route is the rectal route. Here you are administering the medication through the rectum. It is used whenever any kind of oral medications is being contraindicated. If it is not possible, if they are having any oral sores or something, at that point of time we are giving these rectal medications for local and systemic effects. Coming to the next route is the sublingual route, wherein which the medications are placed just under your tongue. The name itself says sublingual. Lingual in the sense below the tongue. So here rapid absorption into the bloodstream is possible with the help of sublingual route. The next route is the topical medications, where we are applying the medications onto the skin. So certain kind of balms, amrutanjans, etc. they are applying on the skin, wherein which local effect on the skin or for transdermal absorption we are using this topical medications. So moving on to our next route is the transdermal route. Here you are applying it on the skin using the patches. There are certain kind of square patches, circular patches, wherein which there is continuous and controlled release of medications. At a time the medications are not released, there is continuous and controlled release of medications with the help of these patches. To relieve the pain in certain areas, they are giving these patches. It's called as transdermal. The next route is intranasal. Name itself is saying to the nose, administering through the nose for rapid absorption through the nasal mucosa. So through the nasal mucosa, there is absorption of the medication. Next route is ophthalmic. So here the medications are applied into the eyes for local effect for the eye conditions. So any kind of eye conditions or any kind of abnormalities, then we are giving the medications to the eye. The next route is optic, where administration of medications is happening to the ears, especially for local effect as well as for any ear conditions. And the final route is the vaginal route. Here we are administering the medications through the vagina for local and systemic effects. If the system, for example, any reproductive issues are there or vaginal issues are there, for those conditions we are giving the medications through the vagina. So this is also one of the most important questions which can be asked for a 5-marker, the routes of administration of medication. So let's move on to our third question, that is comfort devices and their uses. What are comfort devices? It's nothing but these are the tools which are designed to enhance the physical or the psychological comfort. So for example, nobody is sitting on the floor nowadays. We are sitting on a cushioned chairs or sofas. So this is extra added comfort for us. So these are designed only to enhance our physical and psychological comfort. Ergonomic chairs are there, heating pads or relaxation aids, which is aiming, what is its main aim? To promote the relaxation and the well-being of the person, to give him more extra added comfort. So let's see what are the different comfort devices and what are their uses. First one is the backrest. Here we are providing the support for the patients who is sitting in the bed and which is aiding in comfort and preventing the strain for him. Especially these all comfort devices we are using in the hospital settings. So we are giving much comfort for the patients who are sitting for a longer period of time. That is about the backrest. Coming to the second is the knee rest. Here we are elevating the knees to relieve the pressures and also to improve the circulation while they are lying down for a longer period of time. After the operations or after any kind of surgeries, they will be lying down, taking the rest. So in order to elevate the knees or to relieve the pressure, we are giving these knee rests. Coming to the third device is the footrest. What is the help of footrest? It is supporting the feet to maintain a comfortable position and also preventing the pressure ulcers which is seen usually in the foot. The next device is the bed cradle. What it helps, it keeps the bed linens from touching the sensitive areas, for example, the feet or the legs, which is enhancing the comfort. And this bed cradles are usually used in conditions like burns patients, wherein which the linens, the bed linens, it should not touch the body of the patient. So that is why we are using bed cradles usually in the burns patient. Coming to the next device is the bed blockers. Here we are preventing the patients from slipping down from the bed. So bed blockers are usually kept in order to make sure the patient doesn't slip down from the bed, ensuring safety and comfort of the patient. So the next device is the sandbags. Here, the application of the pressure is seen with the help of these sandbags for the body parts. Usually, we are using this for patients who are having fracture in order to immobilize that body part and to reduce the bleeding or swelling aided, which is also giving more comfort. So this was about sandbags. The next device is the air cushions. Here, we are distributing the body weights evenly with the help of these air cushions. So for example, reducing the pressure points and enhancing the comfort. So if a patient is lying down for a longer period of time in one position, there are pressure sores in all the pressure points. In order to avoid that, we are giving these air cushions. The next device is the rubber and the cotton rings. What is the help of this? They are providing the support and comfort to the patients. So with the hemorrhoids or other conditions. So these kind of rubber and cotton rings, they are used in patients who are having hemorrhoids. So for those patients, it's very much difficult to sit in the same position for a longer period of time. Hence, we are giving these cotton and rubber rings. The next device is air and water mattress. Here also we are adjusting the firmness in order to relieve the pressure and support the patient's comfort and healing in cases if they have to lie down or sit down for a longer period of time. It is evenly distributing the body weight. And the last device is the heating pads. It is providing the warmth to the patient in the sense they do not feel that chills, and warmth is provided and to ease the muscle tension and pain. So to decrease the muscle tensions as well as the pain in that person post the surgery especially, and it is promoting comfort and relaxation. So hence these are all the different comfort devices and the uses of them in different hospital settings. Coming to our next very much important question is the types of beds and their uses. You people must have studied what are the different types of beds, how to prepare or make the bed making. What are the help of these kind of beds? In hospital settings, there are different types of bed making techniques. So we can see there are different types of bed, and bed making techniques are also different for different types of beds. So it is used based on the patient's needs and their condition. So each person does not need the same type of bed. According to their condition, we need to change the types of bed making, and the different types of bed is given according to the patient's needs. So each type of bed making in the hospital setting serves the specific purpose, and also it is ensuring the patient comfort, hygiene is maintained, safety of the patient as well as infection prevention according to their clinical needs. So this is the main use of different types of bed making. First, let's see the first type of bed, that is closed bed making. Here, it is used for new kind of admissions. So, if the patient is coming for the first time, for the sake of admission, for those kind of beds, or unoccupied beds. So, patients, if they have not come priorly, we are preparing this bed. So, that is called as closed bed making. It is ensuring, what is the use of it? Cleanliness and readiness for the new patient. That is the most important, idea of making this closed bed making. The second type is the open bed making. It is used for the occupied beds. So, patients who have just already shifted to that bed, it is called as open bed making. We are changing the linens for that patients and you're maintaining the comfort and hygiene for the patient. In the sense, if the patient is already occupied, but still we need to keep on changing the bed linens in order to make sure the comfort and hygiene is maintained. Coming to the third type is the occupied bed making. In the sense, if the patient cannot move from the bed, but still you need to change the linens of the bed. And hence, with the patient on the bed, you are trying to change the linens and making sure there is no disruption and of that patient's safety, as well as there is no disturbance caused to that patient. That should be kept in mind when you're making this occupied bed making. Coming to the next type of bed is the surgical bed making. Here you're preparing the bed for patients who have undergone the surgery. In the sense, patients who is undergoing the surgery, they need to undergo the surgery. For them, you are making the surgical bed making. What you're focusing? You're focusing on maintaining the sterility, sterile environment and sterile bed making. Cleanliness should be made and preventing the infection is your main goal when you're preparing the surgical bed making. The next type of bed is the critical care bed making. What is this critical care bed making? It is used for patients who are under the critical conditions or who are usually in the intensive care units, that is ICUs. So for those patients, you're making this critical care bed making. What you need to keep in mind requires the meticulous attention to patient's comfort and hygiene. You're giving the most important idea about making sure you're giving comfort as well as the hygiene for those patients when you're making this critical care bed making. Coming to the final type of bed making is the isolation bed making. It is used for patients who are having this kind of contagious diseases or certain conditions which can spread from one person to another person very easily. For those kind of patients, you're preparing isolation bed making. What you're keeping in mind? Emphasizing infection control measures to prevent the spread of the pathogens. So, spread of pathogens should not happen. So, that is kept in mind when you're making this isolation bed making. This is one of the most important questions which is very much repeatedly asked for 5 marker and sometimes for 10 marker with other set of questions. So, let's move on to our next question, that is, what is Ryker? Ryker is nothing but it is referring to a type of the fever where a person is experiencing intense chills and also shivering is seen in the patient who are having this kind of fever. So, it is often accompanied by feeling of coldness despite having a high body temperature. Say for example, if a patient is having fever, they always feel cold and shivering is also seen in these patients who are having Ryker. So let's further see what are the different and important stages of Ryker. Stages of Ryker is almost asked in many of the question papers. So let's keenly look on to what are the stages. Coming to the first stage is the cold Ryker. This is one of the first stage or the initial stage where the body experiences intense cold and you can see that kind of sensation of shivering also in the patients. This is the cold Ryker stage or the first stage, and it occurs when the body's temperature regulating system is attempting to increase the body temperature to match the new set point due to the infection or illness. Why this is happening? Due to infection and illness, our body tries to increase the body temperature, but still the patient is feeling that coldness, shivering and also cold sensation they are feeling in the first stage. Coming to the second stage is the hot Ryker stage. It has followed the cold stage. In the sense, after the cold stage, you can see this hot Ryker. The body begins to generate heat through increasing the metabolism. So the metabolism inside of a body increases in this hot Ryker stage, and also you can see the muscle contractions, the twitching and muscle contractions is seen in the patient in this hot stage. You can see this results in sensation of heat and sweating. So in the first stage, there is shivering and cold sensation. Here, there is heat and sweating in the body of the patient. The body tries to reach and stabilize around the new high temperature which has been set point. So according to the requirement of the body tries to increase or decrease the temperature in this hot Ryker stage. Coming to the last or the final stage, the third stage is the resolution stage. Here, the body temperature, it will be stabilizing at the new set point according to the patient's, symptoms what they are showing. See, you can see the Ryker stage resolves. This kind of shivering and sweating, feeling hot or cold, it will be resolved. The body either continues to fight against the infection or the illness. Here, in the last stage, either the body is fighting against the infection or illness, or it begins to recover depending on the underlying causes. So what is the exact cause for this Ryker? According to it, sometimes the body recovers and sometimes it is started to fight against this infection or illness. These are the most important questions for a 5-marker. Please pay attention when you are studying regarding the stages of Ryker. Let's move on to our next question, that is, what is the nurse? So we all are nurses, and what are we? What is the definition of nurse that we are expecting? It is nothing but it's a profession which is focusing on the promotion and maintenance of the health and well-being of the individuals. So our main goal is to promote the health and well-being of the individuals, their families, and the community through the compassionate care. It's not just through the words, but make sure you're giving that kind of care, education and advocacy to the patients. And this is called as the nurse. So let's see what is the liberal meaning of the nurse. So what is the expansion of N-U-R-S-E? N in the sense nobility, knowledge. So you should be noble and kind and have the knowledge. U in the sense usefulness and understanding. You need to be useful for the patient and understand their problems. Coming to what is R is righteousness and responsibility. So you need to understand what is your responsibility and accordingly you need to act as a nurse. And coming to what is S, simplicity and sympathy. So it's not just that if a patient is suffering and you just simply leave and go, you should have sympathy as a nurse. And simplicity is one of the main attitude a nurse should have. And finally, E in the sense efficiency. In the sense, in a particular given time, you should be efficiently working towards giving good care to the patient. So this is the liberal meaning of the nurse, which every nurse should understand. So let's see what are the important qualities of a good nurse. So this is very important. What are the different important qualities a nurse should have? Firstly, love for the fellow men, the people who are working with you. You should have good, compassionate feeling towards them, have love towards the fellow men. The next quality is honesty and loyalty. Do not lie to anybody and be loyal to your patients, to your other fellow men, etc. And the third quality is discipline and obedience. Make sure you maintain discipline throughout your life, through your profession, as well as obedience. Be obedient to your seniors, senior staff, senior nurses, doctors, etc. So the next quality is the ability to inspire confidence. It's not just with your work you're comfortable. You need to inspire your upcoming nurses by the work that you are doing. And the next quality is sympathy and empathy. there is a lot of difference between sympathy and empathy. Showing sympathy, most of the people can do, but being empathetic is only possible with the help of these nurses. So you should stand in their place and understand their difficulties. And the next one is intelligence and common sense. Use your intelligence and little bit of your common sense when you are caring to the patients. The next quality is gentleness and quietness. You should be a very good listener in order to understand what is the difficulty of the patient. You should have that gentleness and quietness. This is one of the important quality of the good nurse. The next quality is good physical and mental health. If your mental and physical health is not good, then how will you be able to give care to the patient? So make sure your physical and mental health is good. And the next quality is patience and sense of humor. So you need to understand the making sure the patience is done. I mean, you should be patient enough to listen to the patient and their family members and use your sense of humor in understanding their difficulties. So they are trying to say something, but your sense of humor, you are understanding differently. So that shouldn't be the situation. So make sure you're having a good sense of humor and maintain patience. And the next quality is alertness and intelligent observation. This is most important quality. You should be very alert, and intelligent observation is necessary when you are assessing the patient. So if your observation skills are bad, then you cannot assess the patient properly. So these are the different and important qualities of the nurse, which is one of the important questions for a 5-marker. Next, let's move on to our next question, that is the scope of nursing. So what is the scope? There is certain range and roles, functions of the nurse, wherein which the responsibilities, activities that are usually followed by a registered nurse, and the education should be there for that nurse, and they have to be authorized to perform, focusing on promoting the health. Their main goal is to promote the health of the patient, preventing the illness and caring for the individuals across their lifespan. If you are a registered nurse, these are your different responsibilities, and you can see it is usually in diverse healthcare settings you can be able to perform these activities as a registered nurse. So it includes the clinical practice, education, research, administration, etc. And one registered nurse, she has different scope in performing different kind of action in different fields, in the sense they can work in different healthcare settings or any other places for that matter. Firstly, they can work in the hospitals, clinics, nursing homes, home health care, in the sense they can go to each and everybody's home and give the health care to the patients. Further, in the public areas, health camps are done and you're giving the health care to them. Schools, they can give health care to the children. Occupational health care in different occupational areas. For example, if there is any cotton industry and there is certain kind of health issues, you can go give care for them. Occupational health care. And next is military. Obviously, people who are wounded in the war fields, for them you can give the care as a military healthcare nurse. The next is in the research field, you can try to invent different kind of medications for which the diseases are being discovered. And the next, telehealth, in the sense you can sit at your home and you can try to call them and give the guidance regarding the healthcare. The next is community health centers. There are different places wherein which it is very remote and they cannot find healthcare. So you can go there and be a community healthcare nurse and give the healthcare to the patients. And further, you can see rehabilitation centers. People who are addicted to drugs, any kind of smoking, alcohol, they are all admitted usually after the treatment is taken to the rehab centers. There you can give the care for them. Further, the nurses are having the opportunities in the hospice care. Hospice hospice care in the sense if the patient are seriously ill, they are at the end of the life stage of theirs. So for them also you have opportunities to give the care that is called as hospice care. Next is correctional facilities. People who have done certain crime and they are in the correctional facility area where you can give mental health care as well as the physical health care for them in the correctional area, that is correctional facilities. Over there also you as a nurse, you can go and give the care for them. Emergency services, certain emergency services. For example, on the road, if a person faints and falls. So in that emergency, being a nurse, you can give care for them, as well as in ambulances. These are also emergency services. And also you can see the emergency care units in the hospital wherein which you can go and work as a nurse. And finally, the travel nursing. So you go to each and every place where healthcare is necessary, you travel and give the care. So these are the different opportunities, that is the scope of the nursing care. So finally, I would like to say, as a nurse, the sky is the limit. Nobody is stopping you to give the care. So this is the end of the session. So for more such important questions and topics, visit the EZI Nurse app. Meet you in the next session. Until then, stay tuned with EZI Nurse. Thank you.